I want to commend Governor Perry, Lieutenant Governor Dewhurst, and the leaders of the Texas House and the Texas Senate for standing strong against expanding Obamacare by expanding the Medicaid population in the state of Texas. They are taking a principled stance, and I think it's a stance that is in the best interest of Texans. Now, our friends outside are sharing rather loudly their view that what do they want? Health care, and when do they want it? Now. Sadly, Obamacare is a program singularly ill-designed to produce that. As Obamacare has been implemented, more and more Americans are seeing the negative consequences of Obamacare. They are seeing jobs drying up. If you're a young person right now coming out of school, with Obamacare beginning to be implemented, the odds are higher that you're going to have a hard time finding a job. If you do find a job, more and more employers are dropping health insurance coverage. So the odds are higher that you're not going to get health insurance from your employer because of Obamacare. And if you are lucky enough to find a job and find a job that has health insurance coverage, we're seeing premiums go up dramatically. When Obamacare was introduced and passed 3 years ago, President Obama promised the country that by the end of his first term, the average family would see his health insurance premiums go down $2,500. The reality has not matched those promises. In fact, what we've seen is the average family has seen their premiums go up by $3,000. That's a $5,500 swing out of the pockets of families that are struggling to make ends meet. If you're a single mom working hard to provide for your kids, more and more families are seeing employers forcibly reduce the hours employees are allowed to work. On the floor of the Senate just a couple of weeks ago, I read from a newspaper article quoting a single mom in Oklahoma who was working at a fast food restaurant where every employee had been forcibly reduced in their hours down to 29 hours. And this single mom said, look, I'm trying to provide for 2 kids at home. I can't do that on 29 hours a week, and it's because of Obamacare that our employers feared they would go out of business if they didn't forcibly reduce the hours people are working. Now, when it comes to Medicaid, Medicaid, unfortunately, is a system that is broken, as President Obama himself has acknowledged. If you look at the data, those who are covered by Medicaid receive substantially worse health care outcomes than do those in private insurance or even those with no insurance at all. The likelihood that those who are covered by Medicaid will spend longer times in the hospital and the likelihood that they will die of treatable diseases is higher than those with private insurance and than those with no insurance whatsoever. And yet what Obamacare is trying to do is move a great many people into Medicaid who are not currently covered. Medicaid right now, roughly 30% of doctors in Texas take Medicaid. That means 7 out of 10 doctors will not take Medicaid. And if you look at other states that have expanded Medicaid populations, what happens over and over again is the percentage of the state covered by private insurance drops and Medicaid picks up the slack. So you will be moving hundreds of thousands of Texans off of private insurance, off of insurance that is allowing them to choose the doctor of their choice, and onto a system that will deny them that health care coverage. Our friends who are saying they want health care do not realize that expanding Medicaid will worsen the health care options for the most vulnerable among us in Texas. Now, many advocates of the expansion say that the federal government is providing free money. Well, it's not free money, it's our money. It's the money that the taxpayers in Texas and all over the country have contributed to. And our federal government right now has a national debt that's larger than the size of our entire economy, $16.5 trillion. But beyond that, the federal government is much like an unscrupulous individual trying to convince a junior high kid to start smoking. They start by giving a few cigarettes and saying, just try it. And there's a bait and switch that's coming. For those states that are buying into this, that are expanding their Medicaid populations, they will come to rue the day because Medicaid will take a larger and larger portion of their state budgets. So if you care about other state priorities, if you think the state needs to devote vital resources to public education, to teacher salaries, to higher education. If you think the state needs to devote additional resources to infrastructure, to roads and water, if you think the state needs to devote sufficient resources to law enforcement and prison, keeping violent criminals off the street, if Medicaid is expanded, that is going to consume a larger and larger share of the state budget that will crowd out education and infrastructure and law enforcement. Medicaid needs fundamental reform. It needs to give the states the flexibility to meet the needs of the most vulnerable among us. And unfortunately, right now, Obamacare goes in the opposite direction. So I commend Governor Perry. I commend Lieutenant Governor Dewhurst. I commend the leaders of the Texas legislature for standing strong. Texas, once again, is leading the way. And John Cornyn and I are proud to stand with our leaders and our friends here in Texas. Thank you.